Viewers, good morning. This morning, I want to address the issue of Uhuru Kenyatta's legacy. The legacy of His Excellency President Uhuru Kenyatta of Kenya keeps on moving, keeps on going forward and forward. Since the handshake in 2018 that brought about the peace, the tranquility, the unity of purpose, President Uhuru's star has been rising. All over Africa, people are thinking of using the model that Kenya used to stop any form of violence, chaos on the streets after elections. As you know, all of you are aware that elections in Africa produce two things: after or before or after the voting. Disputed elections, winner takes it all, loser doesn't accept the results. But the Kenyan model takes us miles and miles away from the normal type of democracy. The democracy, a negotiated format, a consensus format. A democracy that gives consensus a chance. A democracy that talks about the future of a country, the unity of a country, as opposed to a fragmented country, polarized country, where most African countries find themselves in. We have seen in the last 10 years or so, most of the elections in Africa have been contested by the opposition. Very few people in Africa, countries in Africa, where opposition has conceded defeat and come up to congratulate the winner. We have seen the South African model has worked very well. The Ghanaian model has worked so well. I don't see any other country in Africa where the models have worked well. I thought it would be Sierra Leone, but today we see Sierra Leone going back to the same ethnic tensions, as you can see from the reports that are circulating in the international media and the local media. So elections in Africa are contentious issues. They create a contentious position, create a departing point for the people of Africa, of that particular nation. The legacy of Uhuru Kenyatta, therefore, will be remembered for having brought the tranquility that we have today, the peace, the new format, the new tool of having a better organized civil Africa, an Africa without violence, an Africa without chaos after elections, when the opposition accepts to work for the interests of a nation, not personal interests. This has worked in Kenya, and thank you very much, Your Excellency President Uhuru Kenyatta, for the tenacity and the steadfastness that you have guided this handshake up to today. For those who want to mutilate the handshake, belittle the handshake, one lesson they should learn is to look at Libya. Libya was once a territory we all respected. It is no more. Let's keep the handshake and the legacy of President Uhuru Kenyatta. Thank you.
very good morning to you, and thank you for joining us. This is Good Morning Africa. My name is Miriam Mugutu, and of course, as usual, we're coming to you from Nairobi, here, the Kenya's capital, a few minutes past, about 18 minutes past 9 a.m. Here. That was Dr. Matanga giving us some wisdom there in the morning. And on the panel this morning, I'm joined by Douglas Kirimi. Douglas, good morning.
Good morning, Miriam. Good morning to the crew. Good morning to all our viewers across the world. Good afternoon and good evening. And thank you.
All right, very well. And we are also joined by Javan, if I'm not very wrong. Javan, good morning.
Good morning to you, Miriam. Good morning to Douglas. Good morning to our viewers, wherever they are catching this broadcast from. It's a very cool morning from this side of Kenya. Thank you.
Is it? I'm sure there's some sunshine there. Are you still in your winter? Nairobi, it's very beautiful now. It's a beautiful weather. We're enjoying it. And when you walk around,
the same to these areas. Yeah, it is quite sunny these days, and we celebrate the mood. It's a December mood around these areas.
Yes, and it's beginning to feel a lot like Christmas when you walk around in the malls, in the shops, in the streets. People are just happy. I think Christmas will bring some sunshine in people's face. This year has been
Miriam, the only
problem
is that I'm not bought Christmas clothes.
Yes.
The only problem is that I'm not bought Christmas clothes.
Okay, you're not Santa, so it's okay. Jevan, what do you want to say before we start the show?
I was saying that we hope that the Christmas, after the birth of Jesus Christ, for those who subscribe to Christianity, he will not be born around and to be on this mask. Maybe he will come up and these things of mask and sanitization will end because he is the savior.
He's the savior, so he will save us from coronavirus. In the meantime, you can save yourself by wearing a mask, by sanitizing, by washing your hands, by social distancing. Those have been proven to keep corona at bay. Now it's difficult to really not get it, but those are proven ways. So as we wait for the salvation there, please save yourself. Wear your mask while you're in public. And so before we get into the headlines this morning, let's get up to date with the cases of coronavirus. And in Kenya, the confirmed cases right now stands at 89,100. The death toll is 1,545. Recoveries is 69,839. Uganda, also the figures have gone up there, and the confirmed cases is 23,200. The death toll is 207. Recoveries is 9,374. And the total cases in Africa this morning is over 1.7 cases. The recoveries in Africa this morning is, the death toll rather, is 60,525. And recoveries this morning is over 1.39 million cases. Then the continent, of course, the global figures have also gone up, standing at 68.5 million, and the global deaths now stands at 1.5 million, and recovery is at 47.4 million cases worldwide. So let's just get into the topic of the day as we look at the headlines this morning. And the Star newspaper here says BBI ODM pushes for fresh amendments. Uhuru is also discussing changes that are likely to be announced by Friday. That is on page 4 and 5. I think this debate, when you think they've crossed one hurdle, other things now coming up. So let's see what ODM now is pushing for, and that is on page 4 of the Star newspaper. Now, a send-off has divided the BBI Secretariat over a fresh push by ODM to reopen the document for amendments in an acid test of the handshake. At the center of the deadlock is the demand by ODM leader Raila Odinga's team to review distribution of the 17 new constituencies and appointment of the IEBC commissioners. The ODM side is also demanding the proposed Health Service Commission should be entrenched in the constitution and the Independent Policing Oversight Authority elevated to a commission. The stalemate is likely music to the ears of Deputy President William Ruto and his troops, who have separately demanded radical amendments to the bill to build consensus. They've scaled back demands but haven't given up. The Ruto wing says Raila has taken advantage of the handshake to drive a wedge between Uhuru and Ruto that has pushed the DP from the heart of power. Jevan, how do you respond to that?
Miriam, is quite unfortunate that after we thought that we have stepped out of the confusion of a new amendments and so on, that now we have the people who have been pushing for these recommendations, the BBI process. Now they are calling for more amendments. Miriam, for me, I feel like we are drilling this process. And I think now, from the look of things, maybe from the political center, maybe something is cooking. Maybe we might not be knowing what is happening there, but from the look of things, because when you look at the ODM, these are the people who have been saying that we need no changes to the process. And initially, they accommodated the views of the deputy president and those people opposing the process. Therefore, there is something that what have made these people, that is a question that we've been asking ourselves, what have made the ODM, after for those many days calling for no amendments, saying that this process is good the way it is, this document is fine, it's fine-tuned, and they should not not go for further scrutiny or amendments or changes. Then what is this that have driven this move? That is something that will, on the course of this week, we'll be quite sure of what is happening. And I feel like maybe from as far as things that are happening behind the scenes, maybe the people in the handshake, maybe they have started hiding some cards under the table. And that is I think that is a point, because at the end of the day, we might see even this BBI process not going through if we continue going there. Because if the ODM changes will be allowed, then it will be quite significant and prudent that all other views should be taken there. And if we do that, the other people who have been having contrary views, then they will have a chance to amend the process. And in the course of doing all that, we will drill the process. At the end of the day, we might end up opening the entire process once again for all Kenyans to submit their process. And when we start there, Miriam, we might take 2 years. Therefore, 2 years, if we look to the previous process from 2018, and if we take more 2 years doing all that process, that means that we may go beyond 2022, and that is, I think this is quite a good thing, and this is making even the people who are in the Tanga wing to celebrate the church, the civil society. I think today, from what the newspaper is reporting, they might also buy this newspaper in huge numbers, because that is good news to them. And I feel like, yes, let's amend the process if that is what is right now. Let it be open to everybody else now to bring their own amendments, so that at the end of the day we make it look inclusive, because it will not be reduced to ODM kind of affair, Miriam.
All right, very well. Now, Douglas, I mean, there have been a lot of calls from especially the DP side and some other Kenyans who have been feeling other things that needed to be included in the BBI, and some of it were considered the last time that happened there. Do you think that could be one of the reasons why ODM is feeling, hey, if one of the key things we wanted was not met, but some of these things that, say, the DP wanted have been brought on board, then why can't we not push for our own, for what we want? And yesterday in one of the papers there, I think one of the headlines, we had a bit of a technical hitch. We didn't get to fully look at the papers there. There was a headline that suggested that Ruto's team was meeting with Uhuru's team secretly to see to it that some amendments are made in this BBI. Could that be one of the reasons why ODM is feeling, well, if you are going to consider that other side, and one of the key things Raila and his team wanted was the change of, the IEBC and these other things now they're bringing up, we had given up on that. So if you're bringing these people on board and considering their views, then we might as well start making these demands, because we had given up on that. We had compromised on that, and because we needed this process to move forward. But if you're going to consider that, also now consider what we wanted there before. Do you think that could be one of the reasons why they're, Douglas?
Miriam, thank you for that question, and it's a two-ended question. The first question you have asked me is, could it be that the Deputy President and his team pushed for some changes, and ODM now feel it is about time that their changes goes through? Mm-hmm. And also, could it be Ruto Arise and Uhuru's Arise have met, and now is it time for ODM to also push from their hand, push for some changes? I would say yes to both questions. The first question on if Ruto would be able to push, and he was not part of the handshake, and he was also bashing the handshake and doing all manner of things, then I also believe the reforms on IBC and also other amendments and other suggestions, and also amendments that ODM would have wanted to bring on board should have been brought to board, and also have a voice there. I think that what had stopped ODM from complaining before is that they have been the handshake partners with the President Uhuru Kenyatta and our function in Jubilee Party, and the handshake between the Right Honorable Raila Odinga and the President of the Republic of Kenya, His Excellency Uhuru Kenyatta. So I believe ODM are right to do what they are doing. I believe they also can be able to push for their own amendments, because it didn't take a million years for the amendments or months or even years for amendments from the Deputy President, who was not a supporter and also is not a supporter of the BBI process, to go through. So Miriam, I think ODM is right on that. And also the end that we saw that Ruto and Uhuru Sarais are meeting at night to be able to push maybe for some amendments, could have pushed ODM to be able to go and say, look here, guys, we also have some amendments, we can be able to do that. And one of the amendments that I think ODM would be pushing is the reform at IBC, is one of the things that are very close to my heart. I would also want to see reforms at IBC. It is an institution that we want to reform before the next election. We want to make sure that the IBC is able to do the right thing. They are able to conduct elections and also conduct themselves in a manner that represents the hopes and aspirations of millions of Kenyans that will go out in 2022 to vote and also to elect new leaders. And also would like to see an IBC that is reformed, an IBC that gives us an opportunity to be able to exercise our democratic rights, our sovereign rights to vote, and also determine the next government and also the way we govern and also the kind of leaders that we want, Miriam.
All right, very well. Thank you so much. So down there on page 4, there is a story there, Uhuru Ruto secret deal, why BBI could be amended. Let me just read that. And all right, I don't know if this is a shocker to any of us. Allies of President Uhuru Kenyatta and DP William Ruto could reach a consensus likely to see the BBI referendum bill reopened for slight amendments. This possible compromise comes despite claims by some proponents of the Building Bridges initiative process that there is no window for any changes to the published bill. It appears President Kenyatta is engaged in behind-the-scenes maneuvers to ensure Ruto boards the BBI train. Ruto has claimed that the Constitution of Kenya Amendment Bill 2020 can be amended to address his concerns for a win-win situation in the referendum. He calls for an uncontested plebiscite. Ruto's concerns, as well as pressure by Uhuru's handshake partner Raila Odinga's camp that the bill is closed, have pushed the president into a corner, and it has emerged that in order to accommodate some of the DP's reduced BBI demands, the bill might be republished after some minor changes are made. So this is what one expert here is saying. His name is Paul Elkington, and he's the High Court advocate. He spoke to the Star on page 5. This is what he gave his comments. He said signatures were collected on the basis of the published BBI bill. If you want to amend the bill, then you will have to discard the signatures and start afresh. This comes with a price. It tells you that that bill was rushed. Some politicians were pushing for the bill to be kept in abeyance as consultations were being taken. The politicians who are pushing for amendment of the bill are the same ones who told the country that there was no more room for changes. So what basically this lawyer is telling us now, if these amendments were to be put forth, remember the process of signature collection ended last week, and it was presented to the leaders there of the BBI, the secretariat there of the BBI. And over 5.2 million signatures, I think, were collected. And now what this lawyer is saying, that the collection of the signatures were based on that bill that had already been presented. So should anything even change in that, then we'll have the leaders of this initiative will have to go back and have some signature collection. And this might delay the timelines in which some of these things are supposed to be happening from what we've been given there. So, Karanja, how do you think this will change the whole process?
Miriam, these amendments that you are making now will alter the entire BBI process. And for me, I feel like we need to have, and I feel like these people should trust Kenyans to make the decisions. If Kenyans feel like this document is not good, they will make it not see the light of the day. And if they feel the way that the document is, it's good, then they will vote it. But if we continue amending this process, and I feel like, Miriam, there's something that you have said, and I was quite privy to that information, but I decided because it's not, it was a hearsay, but now because they have come from the dailies, that the president is meeting with the the deputy allies and the president allies are meeting in secret, leaving the ODM party outside. We had this a handshake, and this handshake is what give birth to BBI process. Therefore, when you start doing such kind of things, you threaten the BBI, you threaten the handshake. And when you meet the allies of the deputy president, those who have been opposing the BBI process, sidelining the other partners, the ODM, the OIP, and so on, you give these people a reason to start questioning the process. And that is exactly what is happening, because the ODM have realized, if you people are meeting in secret, what is this that you are discussing, that we are out of the matrix? And they feel like in order now to have a equilibrium, let's us also bring our own views, so that at the end of the day, because we accepted the fate at the first place, and now it's like we are about to create more rooms. Also, let us bring our views, and that is what is happening. And I think, Miriam, at the end of the day, we need to have a process that these politicians, these us Kenyans, we don't have a problem. These politicians who are driving this process, they should not start hiding things from the other. They should also come to the table, or whether it means coming with the deputy president team and the former prime minister team and the president team to sit down and discuss. Then that will be quite fair, and unless what we compared to what we are seeing, where people from the Tanga are meeting the Kielewekes from the Uhuru camp, where ODM are meeting the president, sidelining other team. That is why this process have been politicized to a point where, Miriam, we need now to bring more changes. And these changes, Miriam, that we are bringing change to accommodate political parties and politicians' personal interest. And I think if that is the case, Miriam, this process should be reopened to all Kenyans. And I think that should be the case. And if the advocate is saying that the entire process that we had of collecting signatures will be nullified if we alter the process again, Miriam, if that is what the case, Miriam, then let's all Kenyans now, we open a window, whether it's for 2 weeks or 3 weeks, for all Kenyans through the month of December, when we are at home and when other people are relaxing. Maybe they can come up with more good ideas to make this process better, but let it not be reduced to a document of 2-3 politicians who can go there and discuss and bring all the change that fit them, but not that is what is fit to the common Wanjikus.
Yeah, and Douglas, looking at now these fresh new, things that are emerging from this process and what the Chairman has pointed out, now that we are learning that President Uhuru Kenyatta's team and Ruto's side, because President Uhuru Kenyatta is also avoiding a situation where anything could aggravate the already, toxic, is it, situation that has been created for the people who are for or against this BBI. So perhaps he's just trying to find a way of I'm sure he's in a catch-22 right now. He's trying to have a united Kenya because that is what BBI is all about. But also at the same time, his main partner, Raila Odinga, being not involved in some of these maneuvers, backside maneuvers, as the Star puts it, would it cast doubt in the other side? And will they start, maybe make a different turn? And how will that jeopardize? Because we know it's not just the BBI, it's not just a handshake. There was a reason behind that meeting by President Uhuru Kenyatta and Raila. There's a bigger picture to be looked at. Forget what we're seeing now, and just BBI and the referendum that is looming is just a part of arriving or solving or just taking us to the bigger picture there that President Uhuru Kenyatta and Raila had foreseen, of uniting Kenyans, of addressing the issue of inclusivity and all that. So what is at jeopardy? Should the other side start feeling as if, okay, why are we not getting some clarity from President Uhuru Kenyatta's side? Will it jeopardize all the gains that has been made there, Douglas? And what are the dangers?
Thank you, Miriam. I think the President of the Republic of Kenya, Right Honorable Raila Odinga, their meeting and their stand and also their decision to be able to unite Kenya in 2018 on March 9th, when they met at the sidelines of Arambe House in front. They came and shook their hands and decided that Kenya will need to turn a new leaf. And at this point in time, Miriam, we need to also put something into perspective. This handshake business and also anything that involves the Right Honorable Raila Odinga and the president will come to an end before the end of 2021. because the Right Honorable Raila Odinga will be a presidential candidate in the coming election, and the handshake after the delivery of a referendum in 2021, that will be the end of their handshake business, and the president will continue the rest of his legacy as Right Honorable Raila Odinga pursues his personal mission of becoming the president of the Republic of Kenya. One thing that is going to be put into jeopardy is the working relationship that is between the president and the deputy president, and also the Right Honorable Raila Odinga. That will be a very strained relationship, and it is putting cracks into that. And if ODM now insists on that, and then Jubilee and the Order Rising Jubilee decide now to sit down and also come together and bat together against the other handshake partner and also the ODM brigade, there will be a lot of political fireworks in this country, which the president would not have wanted for him to be able to deliver his agenda. We know since 2018, the president has been able to sit down and also deliver a lot of work, because the kind of politicking that we have experienced from opposition has been able to give the president a chance to be able to deliver some of them. The greatest breakthroughs in the development of this country, and also the peace that has been there will be a bit strained in terms of the working relationship between the Right Honorable Raila Odinga and the president himself. So I think, Miriam, a crash of ambitions has come into play now. We would have wished the crash of ambition would happen maybe at the end of 2021. But as it is now, the crash of ambition is that maybe in the middle, we are yet to see what is going to come out of it. Maybe the president and the Right Honorable Raila Odinga will be able to steam it and also be able to quell it, because it is going to affect the agenda of the president. And remember, Miriam, as these people are saying today, there are a lot of voters who are saying the president doesn't need the Right Honorable Raila Odinga for him to be able to deliver. Remember, before 2018, Miriam, this Kenya was divided in the middle. I've given here analysis of how Kenya was divided and how people believe that there can be another country that will be called the People's Republic of Kenya and also the Central Republic of Kenya. And Miriam, this country was divided around tribal lines, party lines, and there was so much that was going in terms of the division in this country. And we have seen that thing is now a thing of the past. We belong together. The people, of course, can be able to experience over 400 government projects, funded projects, the Dongo Kundu bypass, the floating bridge that I like and fancy so much that has been completed at the coast. And all those things, Miriam, that we have been able to experience are going to also come to a halt as we also focus on 2022 campaigns. Remember, the Right Honorable Raila Odinga has his own ambitions. The Deputy President and his allies have an ambition. The President and the people who support the President to complete his term, most of us want the President to finish his ambition in 2022 of uniting Kenya and also bringing development to this country. So, Miriam, in my conclusion, conclusive remarks, I would like to say that the working relationship between the Right Honorable Raila Odinga, the peace of this country, development agenda of the President is at the stake. When the Deputy President allies and also the allies of the President meet to jeopardize the agenda of ODM and also the agenda of the Right Honorable Raila Odinga to be an inclusive partnership between the President and the Right Honorable Raila Odinga and also the Deputy President and his allies.
All right.
The President will be right, Miriam, as I conclude, to be able to incorporate the people from the other side of the Deputy President and his allies, because his agenda, core agenda number one, is to be able to lift together and also unite the people of Kenya, regardless of where they come from, regardless of their party, whether they support him or not, and whether they believe him or not. Okay. He has a core mandate that he has been given to him by the Constitution, and also it is very close to the President of the Republic of Kenya. In his that to be able to unite the people of Kenya, Miriam.
Thank you, Douglas. So now, of course, the DP has come in, and some of his amendments are being now, considered, and we're seeing this behind the scene talks. So perhaps the other side might start feeling as though. I don't know if that will be the case, Jervin, but I'm just trying to imagine perhaps where the headspace is right now. And perhaps they're feeling we were part of the process. We presented our points, and some of the Raila's previous reform proposals included a parliamentary system of government with Prime Minister as head of government, creation of a three-tier system of government, increased allocation of the national cake to the counties up to 45%, but we saw that was given 35%. creation of award fund, which I think that also happened, allowing political parties to nominate IEBC commissioners, which was not included there, overhauling the current electoral commission, which that I don't know if it's in the process, but that has not been done. But I think all sides agree IEBC as it is messed up. And also creation of the Office of Official Opposition, whose leader sits in the National Assembly. I think that was also included. And strengthening regional economic blocks. We also saw that included, and we saw the governors there also putting that as one of the key things they wanted there in the BBS. So they will think, we took our time, we gave our proposals. This team did not even care. This team has been fighting this process from the get-go. They never cared about it. They called it all sort of names, traveled across the country to vilify this whole process. And now they are coming in the last minute where we have reached a very crucial time of moving forward and moving this process forward and seeing it in becoming a bill that will culminate to a referendum, and Kenyans will decide on it. And now they're coming in and they're making these demands over something that they do not even care about. And we know that the DP, even the demands he made until last week, even the latest ones of having the referendum with the election on the same day, having the multiple choice, that was sort of something that he's doubled down on, because even he realized this is something that might not be very practical, but some people have been seeing it as a way that the DP has been using to just either to scuttle the process or to delay the process. So as it is right now, where they're sitting and looking at everything and the history and just the background of this story here, do you think, Jevan, that could be because they've been looking for ways to scuttle the process because they don't believe in this process, or because they've not come out and said we support this BBI? They've just been making demands. So would it be this is a strategy they've been using to scuttle the process, and it is succeeding? Because as it is, I'm sure ODM is not sitting pretty where it is right now, and perhaps they're feeling ways about it. I'm not sure because they've not made out a statement. But what do you think is going on right now? Is the DP succeeding in his strategy?
Yeah, I feel like it's a good strategy, because at the end of the day, it is proving to be working towards scattering the BBA process. And I think from what Douglas was saying, this thing of calling the DP allies to meet the present allies, I think that is what created all this manner of uncertainty between for the ODM people, and that is why we see them even pushing for more amendments, because they feel like these people are fighting the process, but now they bring new recommendations, they are put in place. They are calling for more proposals, and we are about to hear something coming on Friday. Therefore, we see that these people who have been opposing the process, their demands are being heard, but why not ours who are in the core of this process? And I think that is where the process and that is what have made the ODM to push further for these proposals, because they feel like there is more room for this. And I feel like I foresee a situation whereby if what the deputy president is pushing would be put into place, and what the ODM people are pushing will be put into consideration, then this BBA process will not be taken serious as it was in the first place. We might see people now starting to see a situation whereby this process is not about the people of Kenya, but is about the politicians. Because to a point we have seen this process being a process that is trying to unite Kenyans. But if we try to unite politicians for their own political good, for political success, then we see a situation whereby this process will not be taken serious. That is a situation that will come to play very well if the recommendation the ODM are making, the recommendation that Deputy President is making, all people from other quarters start bringing new proposals and the recommendation to the entire process, and that is not what we want. We want this process to be completed by June. That was the timeline. And I see, and today I agree with the former Vice President Musalia Mudavadi when he says that we have been having this process for too long. Let's go for a process whereby now Kenyans will decide to give a fate on what they want with this process. And I think that is where we should be aiming, not to bring more amendments. And Miriam, we have asked Douglas a question. What are the dangers if this handshake will be put into a situation where it will be seen like it is being thrown to a disarray or to a thrown away? Then we have dangers, because we might have a rejuvenated spirits of a tribalism that were there in 2017. We might see a situation whereby the people who lost the election in 2017 starting to agitate for more changes, and they might even abandon the entire BBI BBI process to start agitating what they feel matters to them the most. And that is not the situation that we want. Therefore, I feel like the president, because he's a man who is quite genius in matters politics, he should try now to bring all these people in board and to try to bring a middle ground, so that at the end of the day, he is trying to bring these Kenyans together. But if these people, other side, will see that something is being played behind their back, then all the gains that we have had will be thrown away, and we start having this tribal that we had in after 2017 election. We start having people grouping around, going for the demonstrations, and that will even destroy this country even more, because at the end of the day, Kenyans are already divided. And if we start dividing them more in terms of tribalism and the party politics, then we might end up in a situation that will be messy than what we had in 2017. And that is not our wish. Therefore, I feel like let the government of the day, led by President Uhuru Kenyatta and the former Prime Minister and the Deputy President, let them not push for these more changes. Let it go for a referendum, and whichever side will take the day, then Kenyans will have the determination. And that is my take, because if we continue opening this document further, Miriam, this document will not be serious as it is.
All right, very well. So we shall continue following that story as we have, and we see how that will turn out there. And I'm sure Jeanette will be happy to respond very soon. He's usually very quick to respond to certain things. So let's just wait and see how that will play out. And now the headlines on the Standard newspaper as we get to a close. Uhuru quiet on crisis as Raila's views draw fire. We didn't get to do this story yesterday. We know we are having a crisis right now in our hospitals. A very bad time in the middle of a pandemic, and it's very sad when you're seeing things going, how Kenyans are suffering in our hospitals right now because our nurses there are on strike, our health workers there are on strike. So Uhuru quiet on crisis as Raila's views draw fire. Leader at center of the crisis, President Uhuru Kenyatta. He is yet to comment on the debate on the health worker strike. In the last 2 days, he has had a busy schedule with the youth. And yesterday I was watching an interview by, what is his name, that guy that heads the Secretary General there for the, is it KP? He was at Citizen last night, and he was saying that they had talks with the committee, the Parliamentary Committee on Health, and that's why they were able to call off their strike for the next 14 days, because there seems to be, they were listened, they felt the committee listened to them and were willing to work on a modality to address some of the issues they were raising. So that's why they called off the strike. But we know the nurses haven't called off the strike, so still things are not very good there. And so Deputy President William Ruto here, he said, according to the Standard, he is yet to offer any concrete solution, instead using strike to fault BBI and ask that resources be channeled towards combating the pandemic. And that is what Deputy President has been saying. And COG Chair Wycliffe Oparanya, though health is devolved, governor's response to medics' grievances has fallen, hopefully, short, same as preparedness to deal with pandemic. And also Health CS Mutahi Kagwe, all eyes are on how his ministry will act to slow rising COVID-19 infections and deaths, even as 5.9 billion Kenya shilling supplies waste away at KEMSA stores. And medical workers strike with Kenya in the middle of the worst pandemic ever. The political class is doing little to resolve a devastating strike by health workers, protesting against lack of essential supplies and poor work conditions as Kenyans feel the pain of neglect. And I was just looking at some of the things there that our health workers are working on, are demanding. And President Uhuru Kenyatta, please address this matter as quickly as you can, because a lot of Kenyans right now are suffering. Douglas.
Yes, Miriam.
That health crisis that we're seeing right now in our hospitals. Have you been watching the news? Like, when it comes, I'm so bothered that I can't even just tune in there for a long time. I'll just go watch something else, because when you see how poor Kenyans are suffering in these hospitals right now, it's quite. I was watching another news item from Makueni Hospital and the cancer center, and somebody had come there and they could not get their chemotherapy, and a lot of Kenyans go. I couldn't even watch that. It bothered me and really bothered my peace of mind. I don't know why it's not bothering our leaders.
Miriam, I think one of the things that our readers should be able to do is to also visit those public hospitals and all that. I have visited public hospitals for some time to go and see people, and maybe the recent one I went to donate blood, and I can tell you I cannot go on record for that hospital because the situation was very terrible with this COVID. The reception where people are sitting, people are sick, people are holding the sick people, there are no proper ways of managing those people and all that. The health sector in this country is run down, Miriam. And one of the things that I don't like seeing on TV or on newspapers is what we are told is rotting at KEMSA, what we are told is being sold or be sold at a throwaway price at KEMSA, whereas our hospitals, doctors will always claim there are no PPEs. I'm not a doctor, I'm not a nurse, I cannot be able to verify that. People are complaining, the poor people of this nation cannot access better health care even with NHIF. Miriam, the poor people of this nation are suffering under the hands of county government cartels, people who are supposed to pay doctors, people who are supposed to pick the money from the Ministry of Treasury and also pay the people that are involved in the health sector. In this country, Miriam, the poor people are suffering. Everyone is crying. The doctors are crying about poor working conditions. Poor people are crying that hospitals and there are no hospitals. Can you imagine, Miriam, donating blood is a voluntary thing. When I went to donate blood, these people could not give refreshments. Where is the money allocated for refreshments? They would force you to come with 2 liters of water. When they give you those things, they are the balls that you
There's supposed to be some incentives when you're going to donate blood. It's not there anymore. Like
they want to kill people. When you go donate blood, when you donate your own blood, you die yourself. So people are also running away from donating blood for poor people.
But if I have to carry water,
I would rather go donate blood at Nairobi Hospital than donating blood in a public hospital where they can kill me.
What do they give you at Nairobi Hospital if you go to donate blood? The last time I tried, they told me I had a low blood count, so I couldn't donate. So I've never really donated. Sorry to say.
I've donated blood at Nairobi Hospital, and the treatment that they give a person is like that of a sick person. They treat you well, and these public hospitals, Miriam, are a disgrace. And I'm one of the people who are saying we should not be able to complete. We have tested for over 10 years now, Miriam, and we have seen that for over 8 years, we have seen that devolution of health services to the counties is not the best thing that happened in the counties, Miriam. Because, Miriam, when you go to hospitals, I saw a documentary on Siaya. When you go to Omabe, when you go to Busia, when you go to Meru, when you go to Isiolo, to Kiambu, everywhere, Miriam, to Garissa, people are suffering. And one thing I think the president needs to do is, because we have seen his pilot project on universal health care, and that we need a president to be very decisive on that. Maybe he can cut the funding from counties and also look for a way we can be able to reverse that devolution of health services to the counties, because, Miriam, the poor people are suffering. I go to public hospitals, I cannot sustain myself there even for 20 minutes. It's not pride, Miriam, because people are sick. You cannot stay there. You might get sick in the process of going to check on sick people in public hospitals. One thing I can be able to say is that the president needs to act, and maybe God will help him to have a mind on how to deal with those people, especially the people in the counties who always claim the National Treasury has not given them funds. And when, Miriam, these funds reach to the counties, they also claim the funds are yet to be approved and all manner of things. Then when the financial year is over, they will say, now let's wait for another financial year. The monies are not. Miriam, there is a total crisis in the health sector, and we need the president to say something about it. Let him do something. Maybe he can replace the health sector in the counties with the universal health care. We don't care as Kenyans. People are suffering. People are dying, Miriam.
We just want the health, sector. We just need the government to get a hold of
the information that was in the PPI should is that's the amendment that ODM and Jubilee and also William Ruto people and also people from Rinda Katiba should be talking about. They should be talking about the poor people of this nation. Because, Miriam, when you go to these hospitals, you wonder what is really happening. There are no drugs in dispensaries. There is no nothing. When you get sick in a public hospital, you're more likely to die than getting your life saved.
All right, very well. And you know what is quite interesting? Like, I do have some government health facility near my place. It's a huge building, very good infrastructure. And I'm just thinking if we would just invest in enough staff in this, clinic, if they will just invest in enough equipment, this would go a long way in serving a lot of Kenyans. And even in the state that it is, you still find a lot of Kenyans coming.
I know you're running out of time. And
we are running out of time, and I want Jevan to come in. I'm just saying, and I do understand. I'll have you come in, Douglas, just one moment. And I do understand, because this is very important for President Uhuru Kenyatta, seeing that it is one of his key big four agendas. I don't know who he's talking to. I don't know who has been doing the research for him. I don't know what he's been told is the situation on the ground. But something needs to be done.
Yeah, something needs to be done, Miriam. And it's very, very heartfelt. It's a feeling when you go to these hospitals, and it's very sad to see people in their need of health services not getting those services. And you see the example you're giving of that patient who needed to go for the chemos, and there was no person to care for him or her. And Miriam, something else. You know, I feel like we need to have a mechanism whereby when these doctors are taking an oath of office, they should not take another office, and they should be told not to go for a strike. Come rain, come sunshine. We have not seen police officers going for strike. We have not seen the army going for strike. And the doctors, they get good salaries compared to these people. And when you look at these people, Miriam, they are also in the front line in the fight against COVID-19. Therefore, for me, I feel like I'm not saying doctors are not doing good, but they should have a new mechanism to make their grievances heard. It's not necessarily going to the street, because at the end of the day, Miriam, those lives are to be lost when you are going there for the demonstrations.
All right.
Who will pay that person? Because you're asking for compensation for yourself.
Yes.
Who will pay for that life that was lost when you were absent?
Just a pause, and I'll have you come in, and perhaps maybe this story will help us understand why doctors. I know a country like Germany, if you're a doctor and even an accident happened and you passed there and you never stopped to do something, you'll go to jail, or your license will be revoked. Like, their saving lives is the first key mandate. So you can never even imagine doctors going on strike, and that was never a case even a couple of years ago, even in this country. So now this is just a new something that we have to deal with. This story on the Daily Nation, the front pages: young doctor who gave us his life, ultimate sacrifice like thousands of health workers on the front line in the war against COVID-19. Dr. Stephen Mugusu, 28, continued to serve patients under the most horrible conditions. A determined young man from a humble home, Mr. Mugusu had big dreams, but his country let him down. Now, it is apparently from this story, this doctor had not been paid for 5 months.
Yeah, you see, Miriam, that is why I'm saying this is a two-side scenario. It's a two-way traffic. The doctors should get the best service in this country. They should be well remunerated. They should get the allowances, and at least they should get a unique medical cover, because when you go with a contagious disease, you expose them, and they are in their risk of contracting the disease. But what I'm saying, the doctors should have a new mechanism of going to seek for their grievances, to make their grievances heard, so that when they go there, and they make sure that no life will be lost when they are demonstrating out there, when they have abandoned their duty, when they are on go slows, so that we make sure that it's an all-inclusive kind of an agenda where they save life as they are making their grievances heard. But the scenario that we are in, Miriam, I think even the timing that this doctor doing these demonstrations is also questionable, Miriam. COVID came in March, and they are doing the demonstration on December when you're heading to a festive season. This is to take the advantage of the circumstances so that they may be heard, so that because the numbers are increasing, this is the best time they can make huge and even dubious kind of petitions to the government. I think they are taking advantage of situation. But what I'm saying, the doctors should be protected. They should be given PPEs, but they also should have a massive heart to protect the people of Kenya from this disease. Miriam, when you look at this situation, Miriam, we should not, and I have seen this thing of people saying when a doctor dies, it's like their life are more important than other Kenyans. We have lost 1,500 plus people because of COVID-19, and nobody is complaining about it. In fact, people are told to abstain. And Miriam, we should also have a mechanism to seek whether these doctors contract this COVID-19 on the line of duty, or they contract this disease when they're out there having fun, because they might be going out there being careless and they contract the disease, then they blame it on the government. But all in all said, all Kenyans' life must be protected. And number two things, these doctors are paid to offer the services that they do. This is not Red Cross. These people are on salaries. And that is why I feel the government should pay them. They are paid to give us services, the taxpayers. And when they are bad on duties, it is us who taxpayers who will suffer. Therefore, the doctors should be merciful. And I am not supporting anything, but I'm saying that they should not, this situation, this timing is questionable, and they should have waited a little bit, maybe in January when the numbers are decreasing, so that we see them, they are there for the humanity. But what we have seen doctors who are quite hungry for the money, because at the end of the day, Miriam, I understand they were given some kitty in these COVID-19 times, and these people are getting good services. And Miriam, when you look at the number of doctors who are died, it's very small, it's a very negligible number. It's not a big number, but we are not saying the doctors should die. But when you look at the number, it's not like of other Kenyans, because when you go to these hospitals, Miriam, even at the lowest dispensaries, they have a mask, they have these gloves and so on. And Miriam, when we didn't have COVID, we had other diseases that needed PPEs, and we didn't see them complain. Therefore, this Miriam time, and we should also care for all Kenyans, because all life matters, and life should not be lost because a doctor is on a demonstration. And we should also, after paying them and getting to their demands, they should go for punitive measures because of the duties that they abandoned. That should be there to cater, to ensure in future those kind of things they don't reoccur. That should be my recommendation.
Okay, but also, maybe this has just exposed the underbelly of the problems that are there, that have continued to read our health system. So, as you said there, President Uhuru Kenyatta, universal healthcare, and just the general healthcare of the people of Kenya is just one of the key agendas there that President Uhuru Kenyatta identified and is part of his legacy. So I think all these challenges and all these things that right now are coming to the fore, I hope that the government is taking notes and they're trying to sit down and see how can we best address the issues of Kenya, of Kenyans when it comes to their health. How can we address some of these conditions that our medical staff find themselves in? How can we improve their working conditions? How can we make it better for our doctors there? I'm not saying you don't have a point there, Jervin, but something needs to be done. And a lot of these things, they say they don't even have the PPEs. Whatever they have cannot protect them adequately. So that is just some of the things that they're saying. So I'm hoping that this is a challenge and a problem that now is coming out. And perhaps now we know to what extent now the government, should act, and what can we do moving forward to make sure that we don't have to deal with this, because these are things that Kenyans have been dealing with for a very long time, and now they're just coming out because of the pandemic that we are facing. So President Uhuru Kenyatta, as you sit there and structure and see on how you're going to deliver on your universal healthcare, these other factors around it must be considered, and perhaps you leave this country much healthier than you found it. I think Kenyans will appreciate, and if you can have reforms in our health system, Kenyans will be happy to enjoy that. So, Douglas, as we conclude, I don't know, that story is just depressing for me. As we conclude, Douglas.
Miriam, one of the greatest things that happened to this country is things like universal health care, Rinda Mama, programs by the president and all that.
It has changed lives, absolutely. You see the way it has changed, especially the Linda Mama, and now you can just go to a public hospital, have your child safely, and you're taken care of with the professionals, and then you go home. So the maternal health the maternal deaths have gone really significantly low because of that. So you see, just a good policy in place, and Kenyans will be healthy. Yeah, complete your thought, Douglas.
One thing I think that we need to be able to have an honest conversation as Kenyans is the devolution of health services to the counties.
Absolutely.
That is one thing that has made people so sick. And Miriam, I want you one day when you go to the village, please go to your general hospital or referral hospital around. Go and visit general wards. Go and see how people suffer and share beds. Go and see how people have no drugs. Wanatumwa huko nje and they are told, please go outside and get medicine from out there. And in this country, we have people who fail the president and also who fail his administration. Remember, it is the president who will go and seek for these funds, and also from all our taxes, these monies are pulled together by the National Treasury, and it is sent to these counties, and these governors and the deputy governors and MCAs will take that money and eat that money and make sure that the lives of people are defranchised. And also, when our leaders are coming for interviews, I saw one top government official the other day say when he was on hospital for 15 days, he had a treadmill, and also he had better facilities fixed in his room so that he can be able to relax and also cut weight and all that. We should not have people who are in a class of their own in this country who would come to Kenyans who are suffering. There are Kenyans in Meru General Hospital, Meru Referral Hospital. There are people in Isiolo Referral Hospital who are suffering, cannot afford a treadmill. They cannot be able to afford medicine in their local dispensaries like my own village. So these government leaders should be talking to government and also telling government the truth about the state of our healthcare, the state of our security as sick people, and also as a poor people. We should not have a government that as government officials who come out and also tell us how they had a treadmill, that a treadmill saved their life, how a good diet in hospital, people who used to go and see them in good hospitals. Miriam, I can tell you the truth. You cannot go to a public hospital and tarry for 10 minutes or 20, except that you are sick. You cannot tarry on their reception where people are received before they get those admission booklets. Miriam, one thing that we need to fix as a nation is our health care, and we hope that the cry of the poor people shall reach the president. The way the cry of poor women reached the president, who could not be able to deliver well, who died. I saw statistics from the office of the First Lady when they were doing mobile BOD zero clinics. They were saying a lot of women died during childbirth. I didn't know that because for so many reasons, I am not a woman. And among many other reasons, I didn't know many women die. But when those things came into them, right, Miriam, I honestly, as a man, it is one thing that hurt me, because I wouldn't imagine a poor woman going to give birth, their first child, and the mother and the child die. Maybe the child dies, the mother survives, and the cycle is repeated because of poverty. We have seen the president firmly and decisively deal with that through Rinda Mama program, and we have seen through universal care that things can be able to be reworked. But we need to also, as a country, rethink our own health crisis that we have today. The president and the people of Kenya need to tell each other the truth, including if we can have a referendum on that. Do you want those services taken back by the national government and revitalized, or you want them to remain in the counties? We will have a few people who are in the counties who are eating that monies, and also people of Kenya like me who are suffering when the poor people of this country suffer. Miriam, I have a small privilege. I've not been able to be admitted in public hospital. I'm praying I will not be admitted in that, because Miriam, it is a death trap and people are suffering. Government is giving out money, including loans, to be able to fund healthcare in this country, but that money does not get to the health workers who are frontline workers, and including the poor masses of this nation who make the biggest majority in this nation. So Miriam, as I conclude, we need the president to speak about it. We need to hear more conversations about healthcare. We need to hear more conversations about KEMSA. KEMSA should be disbanded. Why would they have PPEs rotting in their stores when doctors cannot be able to access PPEs, when they cannot be able to attend to people? And poor people in hospitals in this country, Miriam, are suffering. If these people are asked if this health crisis can be able to be resolved and then our lives resume to normal, they will be saying yes. If we have a referendum today that says, do you want health services returned to national, they will return it in the morning. We don't need it in the counties. This, Miriam, is the same thing with the Sonko and Muhammad Badi Nairobi. People of Nairobi don't care whether Badi is illegal or not. What they care is the services. People don't care about the system in counties, especially in Meru. I feel so bad, Miriam, when these things happen in this country and our leaders cannot be able to address this thing head on. So we want the president to address this thing, because governors cannot address it. It is their own cash cow where they eat free money, but the president can be able to do something, because we have seen him through his healthcare agenda. He has been able to firmly and decisively deal with the issues around the maternal healthcare and all that. So Miriam, I pray that the president will listen to that. Thank you.
And I'm sure he has. I'm sure President Kenyatta. And you've mentioned Beyond Zero. I think that is one of the noble things that First Lady Margaret Kenyatta started. I don't know where she has reached with that, but we saw it had some impact and still does. And of course, this is just one of those noble initiatives, and she had a very good and brilliant idea, and this would have really impacted a lot of Kenyans. And then, you know, politics happened, corruption happened, and now that idea there, I wish you know, we would have a lot of that, initiatives like that really impact directly on Kenyans and bring change that Kenyans really need there. And thank you so much. This story, will not get into it because our time is really up. Sonko to face Senate committee. The impeachment of Nairobi Governor Mike Sonko will be considered by an 11-member special committee of the Senate. Yesterday, the Senate Business Committee, which schedules House business, opted for that route, but the decision is subject to approval by the plenary when it convenes for a special sitting today afternoon. And I think the circus has just started. You know, I don't know if he's back from Kwale yet. I'm sure he is. So we will not get into that story because they're meeting this afternoon. So tomorrow in the morning, we'll have a lot to talk about. Sindio. All right. Thank you so much, Douglas Kirini from Meru. Thank you, Jevan Karanja from, Nanyuki. And we shall be back here at 11, now that we're looking at some of these things that we hope President Uhuru Kenyatta will respond and give solutions to. Because, you know, Kenyans don't even know that health system was devolved. What they're thinking there is, what is President Uhuru Kenyatta doing? What is the national? They don't care that governors are misusing funds. They don't care that the doctors, why are the doctors not paid? They will not know that, you know, how that trickles down. They just know what is the government doing. So President Uhuru Kenyatta, you must come out and address this matter, because it really touches on a lot of Kenyans, and they're hoping that this issue in our health sector will be sorted out as soon as possible. So they're just hoping that you will show some leadership. And also when we come back, we shall be looking at President Uhuru Kenyatta's strategic vision for the country. That is quite an exciting conversation that we're going to have. From what you've said, among other things, what has the government been doing so far in addressing some of the issues, and what is the vision that President Uhuru Kenyatta has for the country? We know he has just less than 2 years before the end of his second and last term. So what does he have in store for Kenyans, and how does he intend to live our lives better than he found them? So that is what Kenyans want to know. What do you have in store for us, sir? So we shall have that conversation when we return here at 11 a.m. Thank you so much for watching. My name is Miriam Mobutu. Good morning.